Up to Thursday, March 11, the island's COVID-19 death toll was 475 and climbing. Typically, the most at-risk groups include seniors and persons living with comorbidities. Comorbidities refer to the simultaneous presence of two or more diseases or medical conditions in a patient. Examples include diabetes, hypertension, or renal failure. However, to date, not all persons who have died from the virus were seniors or even had comorbidities. This was a point highlighted by Chief Epidemiologist Dr. Karen Webster-Carr at Thursday's press brief.
When we look at the comorbidities and risk factors for death, 99% of the COVID-related deaths have one or more of the comorbidities or risk factors. We don't often speak about those who don't have. We have had 5 persons who had none of these risk factors for death, and 3 males, 2 females, as young as 36 and up to 54 years. So it may not be common, but the risk is still there. It might be small, but the risk is still there. So we all have to be careful.
Within the last week, we have been seeing a sharp increase in new COVID-19 infections. But what is driving these numbers? Dr. Webster-Carr spoke to this.
So what is fueling the increase? The non-adherence to protocol in all settings. Why do I say that? For example, the increase in workplace clusters. We see that restriction work in decreasing the infection rates. Other factor, interaction among teens and young adults. The highest burden of the disease is among the young adults. And we note that increase and decrease in schools opening and closing is shown. The UK variant would increase the risk of transmission based on what the literature is saying, and there is an increased risk of reinfection.